The bruising on her wrist wasn't from a fall. I clocked that in about 4 seconds, the way you clock things when you've worked the ICU step-down unit long enough that your eyes do the triage before your brain catches up. Mrs. Alvarez, I'm going to ask you something and I need you to just nod or shake your head, okay? Nobody else has to hear the answer. She wouldn't look at me. That was the second thing I clocked. I'd been a respiratory therapist for 6 years by then, weaving through 3 units a night, and I thought I'd seen every version of a person trying to disappear inside their own hospital gown. But something about that Thursday afternoon in October made my chest go tight in a way that had nothing to do with lung sounds. I was drafting the note in my head, the careful, deliberate language you use when you suspect something you can't yet prove, when the door of the adjoining room opened and Dr. Nathaniel Cole stepped out into the hallway like he'd been standing behind it, waiting for a cue. He wasn't my attending. He wasn't even on my floor, technically. He covered cardiology 2 doors down, and in 8 months of crossing paths with him in the break room and the elevator and the vending machine nook nobody actually used, I had maybe heard him say 40 words total. Quiet man, steady hands, the kind of doctor nurses trusted instinctively and gossiped about constantly, because nobody quiet is ever just quiet, right? There's always a story underneath it. We just didn't know his. You need a second set of eyes in there? He asked, low, not stepping past the doorway, giving her privacy she hadn't asked for, but clearly needed. I hadn't paged anyone. I hadn't said a word to anyone in the hallway, and yet there he was, like he'd materialized out of the recycled hospital air exactly when I needed backup. How did you? I started. Lucky timing, he said, and that was all. He always said something like that. Lucky timing, happened to be passing, was already headed this way. 4 different excuses over 4 different months, and I'd been too buried in 12-hour shifts to ever ask myself why the timing kept being so relentlessly, suspiciously lucky. That day, between the 2 of us, we got Mrs. Alvarez connected with the social worker and a safety plan and a number she could call from somewhere that wasn't her own house. Nathaniel didn't say much through any of it. He just stood there being a wall someone could lean against without having to ask permission. Afterward, in the stairwell, because we both apparently preferred the stairwell to small talk in the elevator, I finally said it. You do this a lot. Show up right when things go sideways. Do I? You know you do. He looked at me for a second longer than was strictly professional, and something moved behind his eyes that I couldn't name yet, and then he said, maybe I just pay attention, and took the stairs 2 at a time before I could ask what exactly he'd been paying attention to. I want to tell you I let it go. I didn't. For the next several months, I started noticing the pattern, the way you notice a song you've heard so many times, you finally catch the lyrics. The night my patient coded, and I froze for 1.5 seconds too long, he was already in the doorway before the second alarm finished sounding. The afternoon I got chewed out by a family member in the hallway, loud enough that other patients could hear, and somehow, within 90 seconds, Nathaniel was walking past with a chart he clearly didn't need, positioning himself close enough that the man lowered his voice. The week I worked 6 nights straight, covering for a co-worker on leave, and started crying in the supply closet because I was so tired I couldn't see straight. And when I came out, red-eyed, there was a coffee sitting on the counter outside, with my name on a sticky note in handwriting I'd never seen before and somehow immediately recognized as his. We got closer, slowly, the way trust does in a place that runs on exhaustion and adrenaline. Coffee in the cafeteria that turned into 40 minutes instead of 10. A running joke about the vending machine that only dispensed pretzels on alternating Tuesdays. He asked about my sister once, and I don't remember ever mentioning I had a sister, and I filed that away too. Another small, strange thing in a drawer full of small, strange things I wasn't ready to open. I started to let myself think about it, about him, about what it would mean to be looked after like that by someone who never made a show of it. Then my own life did the thing lives do, and 8 months after Mrs. Alvarez, budget cuts hit our unit, and my position was one of the ones that got folded, quietly, apologetically, into someone else's job description. I cleaned out my locker on a Friday afternoon in June. Nathaniel was in surgery. I left without saying goodbye to him because I told myself I'd text him, and texting felt easier than watching his face while I said the word leaving. It was 3 weeks later, unemployed and restless, and combing through old emails for my final paperwork, that I found it. A message thread I wasn't supposed to have access to, forwarded to me by mistake by someone in HR who was cleaning up a shared drive. An email chain between Nathaniel and my old nurse manager, going back over a year. He'd asked, quietly and repeatedly, to be notified whenever I was scheduled for a difficult patient, a high acuity case, a family known for aggression. He'd asked once, almost sheepishly, if there was a way to adjust the on-call rotation so his shifts would overlap with mine more often, for coverage purposes. And in the very first email, dated the week I started, he'd written one sentence that undid me completely. My cousin was a nurse. She didn't make it through her first 2 years here. I'd like to help make sure other people do. He hadn't been watching me because of some fated cinematic pull. Or, not only that, he'd been watching because he'd already lost someone to exactly the kind of unit I worked in, and some quiet, grieving part of him had decided, without ever telling me, that he wasn't going to let it happen twice on his watch. I sat with my laptop open for a long time that afternoon, not sure whether I felt loved or managed, protected or watched, and I still go back and forth on that, if I'm honest. Was it romantic that he showed up for me over and over without asking for anything back? Or was there something a little sad in the fact that I never got to choose whether I wanted watching over, that it happened to me instead of with me? I called him that evening. My hands were shaking a little, which annoyed me because I don't shake. I found the emails, I said, no greeting, no warm-up. Silence on the line. Then quietly, I was going to tell you eventually. When? After I found another job? After I forgot I ever worked there? I don't know, he admitted, and it was the most words he'd ever used to say so little, and somehow that honesty landed harder than any explanation could have. I didn't know how to bring it up without it sounding like, I don't know what it would have sounded like. Like you'd been quietly looking out for me for over a year because you were scared of losing someone else. Yeah, he said, like that. We talked for 2 hours that night, longer than we'd ever talked in a hospital hallway, and somewhere in there the conversation stopped being about explanations and started being about two people deciding, out loud, whether they wanted to try this for real, not as a nurse and the doctor from the next unit over, not as a rescue and the one being rescued, but just as two people, on equal footing, for the first time since we'd met. We're 1.5 years in now. I work somewhere else these days, somewhere with better hours and a manager who doesn't quietly forward my schedule to anyone. He still doesn't say much. He still shows up at exactly the right moment, but now he tells me beforehand. Now it's a choice we both make instead of a secret he carries alone. I think about Mrs. Alvarez sometimes, and about that stairwell, and about how long I walked past the answer to a question I hadn't even known how to ask. And I still wonder, some nights, if you found out someone had been quietly protecting you the whole time, before you ever loved them back, would that feel like the beginning of something? Or like something you'd already lost the choice in? I still haven't landed on just one answer. Maybe there isn't one.